Caribbean HIV/AIDS Alliance hosts one-day seminar on stigma and discrimination. Healthy Aging discussed at a national consultation, and Dominica's Director of Telecoms to take up new position at United Nations Agency for Telecommunications. Hello and thanks for joining us on this edition of National Focus. I'm your presenter, Tarnia Green.
And I'm Fontaine. Stay with us for details of the headline stories and others after the break.
Documentaries and in-depth discussions, community walkthroughs, and Yes We Care. See it all on GIS, Channel 7.
Welcome back. Time now for the details of the news. The Caribbean HIV/AIDS Alliance hosted a high-level seminar at the Gare Hotel on Wednesday. At that forum, participants were sensitized on issues of stigma and discrimination experienced by key populations at higher risk of infection. Participants also discussed lessons, recommendations, and policy implications of anti-stigma and discrimination programs in Dominica.
Our focus here today is on increasing the awareness of the issues of stigma and discrimination faced by these populations by targeting key policymakers who will be influential in guiding the process to a more open and just community where human rights are respected regardless of status, sexuality, or other factors. By the end of today's deliberations, we hope that everyone will leave here with a heightened sensitivity of these issues and the policies which need to be developed to address them.
Coordinator of the National HIV/AIDS Response Program, Julie Frampton, at Wednesday's seminar, gave details of the status of HIV/AIDS in Dominica and the national response to the epidemic. The first case was identified in Dominica in 1987, and at the end of 2012, there were 396 reported cases. 70% of the cases are males between the ages of 24 and 49. There were 20 new cases in 2012, 15 of which were males and 5 females. Frampton noted that in last year's cases, the most affected were the older age groups from the 30s to the 50s. Response to the epidemic on a national level began in 1987 and was expanded in 2001.
There was this Nassau Declaration with CARICOM governments where all countries were mandated to expand their response. Dominica did by starting with the Prevention of Mother-to-Child Transmission Program in 2001. And that was headed by Mrs. Desabé, and she's still doing that. And that's one of our success stories in terms of programmatic areas. Building on that, a strategic plan was developed in 2002, and we revised in 2010. We're still having issues with that. And the goals, some of you were in that room when we decided to keep the goal of the strategic plan to reduce the incidence of HIV in Dominica and to alleviate the negative impacts of HIV and AIDS on persons infected and affected. So we kept this goal from 2002. Everybody thought it was still relevant, so we maintained that.
Chief of Party at the Caribbean HIV/AIDS Alliance, Dr. Dennis Chivans, spoke of the role of the alliance in the region. The CHAA was launched as a country program of the International HIV/AIDS Alliance in 2003 with technical and financial assistance from USAID. Its mission is to facilitate effective and collective community action to reduce the impact of HIV and AIDS across the Caribbean.
Among our strategic objectives is to ensure alignment with PANCAP's Caribbean Regional Strategic Framework, also the National Strategic Plans and Policies, and the PEPFAR Partnership Framework. Our work is always in support of the work of the NARP here in Dominica, so we're here to support and to help to strengthen the response here in Dominica. And we're doing so with funding under this particular project. This particular project is called the Eastern Caribbean Community Action Project 2. It's funded by the United States Agency for International Development, or USAID, under the PEPFAR framework. PEPFAR, the President Emergency Plan for AIDS Relief.
Wednesday's seminar included a presentation on a draft national policy on HIV and AIDS by Nadette Langford and a presentation on law, ethics and human rights by Magistrate Gloria Augustus.
The well-being of Dominica's elders was the focus of a consultation held on Wednesday to discuss ways of enhancing the quality of life for older persons by promoting healthy aging. The meeting, which was attended by a number of older persons, medical professionals, and other stakeholders, was held at the Public Service Training Center. Also present at the consultation was the Minister for Social Services, Community Development, and Gender Affairs, Honorable Gloria Shillingford. The minister applauded the effort, saying that Dominicans are doing something right. She outlined the roles played by her ministry and the Ministry of Health in such a discussion.
Aging is an inevitable part of living, the living process, and need not be seen as a burden or blight. Rather, the objective towards which we must all work is to maintain good health as we age. This responsibility lies on every one of us as individuals, for we are all responsible for our own health. However, it must be recognized that the health and social services machinery of every country must also play critical roles in the provision of services and facilities to assist citizens in living healthy lives. The Ministry of Health has great responsibility as far as health education, medical care, and cure are concerned. However, the Ministry of Social Services also plays a key role in the areas of home care and provision of basic necessities for healthy living.
Dr. Martin Christmas, who is Director of Primary Health Care, served as chairman of the consultation.
One realizes that we do not stop succeeding, working, challenging ourselves because we get older. In fact, we actually get older because we stop doing all of these things. It is important that we realize the power that lies within the unity, that all of the persons here present have to work together to develop these healthy policies on aging, which are something that we have recognized for quite some time is very important to society. We have an aging population, and that is something that not only consumes from the economy, but also reduces the inputs into the economy as persons become older and, if in an unhealthy state, are less able to contribute.
The president of Dominica's Council on Aging, Evander Joseph, in his remarks, stated that he is happy to collaborate with the organizers to promote healthy aging among Dominicans.
On behalf of the older persons of Dominica, I am honored to participate in the important consultation and associate myself with decision arrived at to ensure that our older persons grow old gracefully and healthily, with respect and dignity, live healthy lives which will afford them to be more productive in their later lives and to enjoy life to the fullest. Older persons see the need for income security, flexible employment opportunities, access to affordable health care and medicines, age-friendly housing and transportation, elimination of discrimination and violence and abuse targeted at older persons, and the desire to remain active and respective members of society. All these are attributes of healthy aging.
The main feature of the consultation was a report presented by Nurse Joan Henry, former director of the Health Promotion Resource Center. She listed the objectives of the report and consultation.
To increase public knowledge of everyday life, real-life situation that concerns older persons, and to highlight the social determinants, that is, the living conditions that impact healthy aging process of our population. To foster informed decision relevant to developing suitable healthy aging policy and action plans.
The report was essentially a survey conducted within the 7 health districts in Dominica, in which over 400 elders participated. It indicated the distribution of older persons on the island and their religions, among other details of the aging population. The consultation ended with a discussion among participants on ways in which healthy aging can be promoted.
And effective March 1st, 2013, Sylvester Cadet, who has worked as Dominica's telecoms director for the past 15 years, will take up a new position as program officer at the International Telecommunications Union, the ITU, based in Barbados. The International Telecommunications Union is the United Nations specialized agency for telecommunications. Cadet, who holds a master's in telecommunications engineering, brings with him a wealth of knowledge and experience in the area of telecoms, having been formally trained in telecoms management, policy and spectrum. He has embraced the new ITU position with humility and looks forward to making a valuable contribution to the wider region.
That opportunity has been afforded me through employment with the United Nations Specialized Agency for Telecommunications and ICTs, that is the International Telecommunications Union. And that I would embrace with humility and the knowledge that one can impact on the region and also continue to impact on Dominica. And that for me is what propels me forward. The thought, the notion that I can continue to be of significant benefit to not just Dominica, but the wider region.
As Director of Telecoms in Dominica, Cadet was able to elevate and transform Dominica's telecommunications sector. He cites the development of the ICT development program as a hallmark achievement under his directorship.
Many individuals would have been acquainted with the ICT development program, the EU-funded SFA 2005 program. That, of course, touched many areas, including, of course, legislation, capacity building. It included curriculum development for the schools at different levels, that is primary, secondary level, training of teachers, and also looking at the development of the sector from an employment standpoint. So right now, one would see the development of Clare Harbour as a typical example. That could not happen if we did not have the requisite infrastructure.
Cadet believes his understanding of telecommunications in the Caribbean region served as a catalyst to landing him this new position at the ITU.
From a regional perspective, one was able to have seen the intricacies of the telecommunications sector as it unfolded. I always call it the days of miracles and wonders. As they unfolded during the latter part of the 20th century, and as we transition to the 21st, and also understanding the pulse of telecommunications in the Caribbean region in particular. In the first instance, I would be dealing with Caribbean countries as far as the Caribbean member states of the ITU. So that in itself gave, I would think, me that kind of leverage.
The International Telecommunications Union, which was established in 1865 as an impartial international organization within which governments and the private sector could coordinate the operation of telecommunication networks and services, and advance the development of information and communication technology.
Finally, Permanent Secretary in the Ministry of Tourism, Claudia Bellot, addressed vendors and tour guides on the subject of their contributions to the island's tourism sector. Bellot was speaking at a ceremony where 80 tourism stakeholders graduated from tourism refresher courses facilitated by the Dominica State College. The tourism official began by explaining the concept of customer satisfaction in the overall customer service experience.
There is a misconception about standards of service, which says that if the service provider thinks that the standard of service they are offering is good enough, then it is good enough for the client. However, excellent service is always about meeting and surpassing the needs and expectations of the customer. So it is all about the customer. If the customer is not satisfied, if the customer is not pleased, you may have thought that you did an excellent job, but you have left your customer still feeling dissatisfied, not having fulfilled the need that they came to you for service. So we must be very, very careful that we do not think that whatever we are doing is good enough. We always have to ensure that the client or the customer is fully satisfied after they have passed through our business.
According to Bellot, in the tourism service sector, customer satisfaction must be foremost in all stakeholders' minds. Furthermore, she advised vendors to pay attention to the image of the establishment while urging them to be on the lookout for cooperation opportunities.
From time to time, as vendors, you also need to take a second look at the nature of your business and whether there is a need to refresh your products, to source new products for sale, or to change the manner in which you display and present your products to the visitors, and also how you present yourself through your attire and through your attitude. It is also very useful, I think, for you to form a very close relationship with persons such as the local crafts persons and others who are engaged in creating products or formulating products which you feel may be, attractive to the visitors and which you can sell. In your interaction with those persons, you may be able to provide them with ideas on the type of products which may be popular with the visitor and which they may be able to produce for you.
On that note, Permanent Secretary Bellot emphasized the need for authentic Dominican products to be exhibited to visitors. Her encouragement to local tour guides was to keep abreast of the available updated information related to Dominica.
You need to, on your own, try to keep updated on information that is coming out on Dominica, on the destination. There are many avenues in which you can source information. You can source information through the ministry, through the DDA. You can source information online. There are several websites which provide authentic and accurate information on Dominica. And so what I would like to urge you is not to wait until you are called into a training session to update the information that you have. Information today is not static. It keeps changing. And you have to ensure as tour guides that you have always, every day, the correct information to pass on to the visitors.
Bellot concluded that in a $300 million industry, each Dominican is affected by the success of the tourism sector, and so she urged Dominicans to make the best first impressions possible. Tarnia, so I believe that this refresher course for service providers and for vendors is an excellent idea. It keeps them abreast of what's to come, new things that are going on, how they can better themselves. And hats off to the Ministry of Tourism for that initiative. I think it's a great one.
Yes, because Pearl, vendors and tour guides are really true ambassadors of Dominica. They are really the persons that the tourists come in contact with first when they arrive on the island. So basically people want to interact with visitors in a way that will encourage them to come back to the country. And so there are many things that the vendors and the taxi operators, as well as the tour guides, need to think about very seriously. The issue of visitor harassment, we've been hearing a lot about that in the news, on the need to ensure that the visitors feel comfortable when they come to the island. The issue of how the tour guides treat the visitors. In recent times, we had very unfortunate incidents where visitors have come to the island and they have lost their lives. It's important that the tour guides know how to deal with situations like that in cases of emergencies, in cases of accidents, that kind of thing. So, of course, these refresher courses are very important because it helps, it sets the tone, it educates, it enhances the knowledge of the persons who are the first point persons interacting with the visitors on the island.
I'd like to, say something that I heard yesterday from Merrill Matthew, who's the dean of the faculty at the Dominica State College. They facilitated this course, and he basically said that if tourism service providers don't understand that their role is critical and fundamental, then we're in trouble, because they are the first people, like you said, that tourists see. And so, once they know that it's always about them and how the tourists see them and their perception of them, I mean, come on, then that's the only reason why they would come back, because they had such a good time with these people.
Right.
But on the other note, tourists always talk about Dominicans and how they're so friendly. So, to the vendors who are doing a great job, I, just want to say well done.
Okay, and that's the English segment of the news. Macpherson St. Louis is up next with the Creole highlights.
Allô tout le monde, bienvenue à cette nouvelle en créole. Non, moi, c'est Macpherson St. Louis. Premièrement, le gouvernement Dominique a continué de discussion et puis le gouvernement Morocco pour coopération neuf pour le ministre Honorable Roosevelt Skerritt qui visitait Morocco l'autre jour là, fait parole qui discussion tient pour un projet marine pour Dominique et aussi fait parole qui pays ça là d'accord pour un pli a scholarship ba Dominicain étudier en pays Morocco. Dominique n'est 21 étudiant en Morocco qui a étudié à présent. Dominique et puis Morocco aussi si coopération pour plus assistance en affaires agricoles. Dominique établit relations diplomatiques et puis Morocco en l'année 2010. En la nouvelle, en consultation qui mettait attention à ces status moun à l'âge en Dominique pour place Jodéa. Plusieurs organisations moun à l'âge tant report en survey qui te tiennent pour déterminer status moun à l'âge en Dominique. Ancien officier promotion ministre en santé North John Henry présentait report survey là pendant consultation la Jodéa.
C'est pour mener information nous taper. Dans survey nous fait l'année 2009, novembre-décembre. Nous allons tout en Dominique et nous parler avec mon dans l'âge, pour connaître ça qui en la vie qui a aidé ni en la vie en bonne santé et bien ça qui en la vie qui a gens de santé avec nous parler ba 400 moun avec nous information là nous taper associé moi ça là c'est ça moi ka bail jodi là.
Henry fait parole différentes situations qui concernent moun en l'âge en Dominique.
Une situation là moun confortable. Une situation là moun pas confortable. Une situation là moun malade. Une situation où là moun pas malade mais yo pas une situation là pour faire la vie au bon. So in différentes situations, et bien c'est pas qu'on dit il met ozo passer gontance et bien la pointe. Tout partout où aller Dominique à présent, il y a des gens qui bon, il y a des gens qui ni bagay mauvais. Ça n'est pour ça, c'est ça nous ça fait et vers ces gens là pour faire la vie au meilleur. Et vers ça yo ni pour dire. Puis là nous aller dans là 2009. Ces gens là teni bagay en valeur, yo te ça dit nous. Bagay comment yo te ka garder compte à manger yo comment yo style là et vers présent yo content les moun venir parler ba yo puis une compagnie puis en dedans yo te ka vivre par corps yo And then yo le ka viv pa koyo, puis yo le viv pa koyo. Les autres ka viv pa koyo, puis yo pa ni, comment on ka dit ça? Yo pa ni moun pou chepe yo, so yo ni pou viv pa koyo. So, il y a différentes situations.
En autre nouvelle, on sait maintenant qui mettait attention à ces affaires sida et puis discrimination prend place en Dominique Jardin. Organisation CHEA tient semaine là qui officie tape report status sida en Dominique. Madame Joanne George, c'est officier CHEA.
Nous qui tout le monde qui travaille à Dominique, le monde qui a fait législation pour venir parler code sida et ça qui a fait et puis monde qui ni sida et monde qui pli à position pour taper sida. So tout le monde qui a fait loi nous camarades pour parler ensemble pour nous faire tout le monde connaître ça monde qui ni sida ça yo ka expérience à Dominique.
Et puis finalement programme Child Friendly Schools qui ministre éducation a implémenté en l'école à présent, c'est policy ministre éducation. Parole Salah Sotiod, chef exécutif officier ministre éducation, M. Steve Hyacinth. Hyacinth fait parole Salah comme plusieurs teachers ont participé en workshop qui était organisé pour mettre en garde, développer un meilleur environnement où là tous les enfants apprennent à l'école. M. Hyacinth fait parole que chaque étudiant ni un droit et puis l'école supposée engager ces étudiants-là et puis bagaille ils ça apprendre. Et des étudiants supposés bien éwé en l'école-là, bagaille teacher supposé engager eux. Ça fait violence et puis abuser, supposé pas une pièce place en curriculum l'école-là et puis moral teacher supposé à tête. On l'autre bagaille Hyacinth fait parole, c'est partnership et puis community là de l'école et aussi couiller pour participation power en activité c'est l'école là. Mais c'est mesdames, ça c'est tout pour nouvelle créole pour à présent. Non moi c'est Mac Fontaine Saint-Louis. Voilà.
When we come back, we'll bring you the tip of the day.
The facts as they are, brought to you every day, only on GIS Channel 7.
In today's tip, we'll share with you a few tips on how to be charismatic. Inspirational leaders have charisma. People want to hear what they have to say and do what they advise. But can you learn to be inspiring? Sure. Here are 3 things you can do to build your charisma. Focus on others. Don't concentrate on what you need and want. Understand what others care about. The more you can relate on a human level, the better. Put yourself out there, seek out and engage others. Be upbeat whenever possible so others feel the same way.
Communicate you care. Charismatic leaders are verbally expressive. Tell stories. Use concrete examples. Talk about your feelings. All of these things will invoke common ground in an audience. And that's all for this edition of National Focus. We always welcome your suggestions and comments. Drop us an email at gis@dominica.gov.dm or visit our website at news.gov.dm.
Friend us on our Facebook page and be sure to like our GIS Dominica fan page. You can also catch up on past national-focused newscasts on our GIS Dominica YouTube channel. On behalf of the entire news production team, I'm Pearl Fontaine.
And I'm Tarnia Green. Thank you so much for watching.